Welcome back, folks. It has been too long, way too long, but he's back. By popular demand, State Assemblyman Herb Conaway Jr., the chair of the Assembly Health Committee, also a physician, one of the, Herb, are you the only one?
I think I'm the only one. That's right.
You're the only one. Hey, Herb, thank you so much for joining us.
Glad to be here.
And I'm only calling the Assemblyman and Dr. Conaway Herb because we go back too long. Hey, let me jump into this. You have so many issues, health-related issues that you and your colleagues are dealing with. But as it relates to issues of racial disparity regarding health outcomes, what has COVID taught us to date as we tape at the end of June, and what do we need to do more importantly moving forward to close that gap?
Well, the pandemic has brought the health disparities, which have always been there, into sharp relief. When you look at the statistics on who became ill, who died of COVID, who was getting vaccinated for COVID, or rather against COVID, you see that there are disparities. Again, racial disparities that have always been there, but because of the glaring light of pandemic, has brought these issues to light and has rightly caused government officials and healthcare officials, public health officials to pay more attention to the issue and to take steps to address it.
You know, let's deal with the vaccine issue. My sense is all kinds of people coming to you, black, white, Hispanic, they ask a million questions about the vaccine. The vaccine resistance in the African-American community, how have you taken that on directly?
Well, to tell a personal story, I've been vaccinated, my children have been vaccinated, and fortunately, while we've had some side effects from the vaccine, which are expected, if you get a tetanus shot, you get arm pain. If you get the flu shot, occasionally you feel, unwell for a couple of days, but you have the peace of mind of knowing that you're now protected against the likelihood, I shouldn't say the likelihood, but the possibility of death from COVID. And so I tell people, if you want to be there for your child's wedding, if you want to be there just to enjoy life, if you want to be part of the solution in stopping the spread of this disease, then you should get vaccinated. It is a safe vaccine. They're highly effective, and you'll be doing a good thing not only for yourself and your family, but for your state and nation, indeed, as well.
Herb, it's so funny you say this. My wife and I are going to a wedding with our kids at the end of this week, and it's a close friend, but go back when we were kids, growing up in the old neighborhood, and he's not vaccinated. His wife's not vaccinated. Their kids aren't vaccinated. When I pushed him, I'm not going to say his name because people might figure it out. He's like, no, it's my right. And the quote, government's not going to tell me what to do. And we got into a heated argument about it because he's having 300 people at a wedding. Is it someone's right to say, no, you don't tell me what to do. This is my right not to get vaccinated, but have 300 people at a wedding?
Well, it is your right to say no, but it's also well within the government's responsibility to take measures in response to your refusal to vaccinate. We do this in the vaccination program for school-age children. You have a right not to vaccinate your child, but the government and society also has the right and the responsibility to say, then your children need to be excluded from school. Employers, you have a right not to get vaccinated, but employers, particularly private employers, can say, you're a threat to my workforce. We've already had a tough time dealing with this pandemic. You bring a risk of exposure to a workforce, which could make the pandemic as to our small business even worse. And so I have a right to exclude you from work and ask you to seek other employment. So as long as people are willing to face the consequences of those decisions, whether it be to their schooling or to their job, or if they're willing to live with the fact that they're infecting other people, quite frankly, then go ahead and not get vaccinated. But I think it's ill-advised. We agree on that. And hopefully with constant reassurance and I would say kind reinforcement of the need to get vaccinated, people.
Yeah, I need to be kinder to friends who are resisting. I always say, listen, you have a choice to make that decision, but don't think that it doesn't just affect you. But I'm not a physician. He is. Dr. Assemblyman Conaway Herb, let me ask you this. Assembly Resolution 212, I know it has to do with the New Jersey Sharing Network, and they are involved and they lead the effort in organ and tissue donation, and we are very actively involved in a public awareness initiative around organ and tissue donation. What is Assembly Resolution 212, and why does it matter so much to the organ and tissue donation community?
Well, the New Jersey Sharing Network here in New Jersey over the last 30 years have saved more than 15,000 people, have enhanced their lives, and we want them to continue to do that. They have been able to increase their procurement of organs over that period of time. And unfortunately, the Trump administration at the time was pursuing policies which might have shut down half of the operations in the country, depriving people of life-saving tissues and organs. And we thought it appropriate, working with the organ procurement organizations, particularly New Jersey Sharing Network and others in the legislature, to say to the Trump administration, don't move forward with these rules which can imperil lives that could otherwise be saved.
Explain again, Herm, what are the rules of the previous administration and how do they affect organ and tissue donation?
Well, they were changing some of the reporting rules that would have made it very difficult for the organ procurement operations to in fact, procure organs and distribute them to people who needed them. We believe that the policy thrust by the Trump administration was in contravention of law and expressed that to the Congress and by resolution. Fortunately, that policy is now not going to be put in place, and the business of saving lives through tissue and organ donation will continue and hopefully grow in the years to come.
Okay, as the chair of the Assembly Health Committee, let me ask you this. Top 3 issues in 2021 into 2022 other than continuing to deal with COVID are?
Well, I will mention COVID. We need to make sure that we understand all that happened. One of the things that this pandemic exposed is that we are not as prepared as we might have been. And that's not only New Jersey. This is nationally, and so we need to debrief what's happened and begin to plan to prepare for the next pandemic. We need going forward in the coming year to deal with this question of racial disparity around healthcare. We know that it exists. We've taken a number of measures in terms of telehealth, providing a means for hospitals to partner to develop housing. Housing means stability for individuals in the population area of the hospitals that will allow the provision of healthcare, education, job training, transportation to and from doctor's appointments that will enhance the lives of people who have unfortunately done without. And I think going forward too, we need to understand data and acquire as much data as we can in the healthcare space, indeed all space, but particularly in the healthcare space, because that needs to drive policy. It has been driving policy, but we know that we can improve our ability to capture and manage data and use it for the popular good.
Thank you, Assemblyman Dr. Herb Conaway, the chair of the Assembly Health Committee. Thank you so much, Herb. We look forward to having you back again real soon. I'm
looking forward to it myself. Be well and stay well.
Same to you. I'm Steve Adubato. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, PNC, Grow Up Great, Holy Name Medical Center, Choose New Jersey, TD Bank, Rowan University, Operating Engineers, Local 825, and by these public-spirited organizations, individuals, and associations committed to informing New Jersey citizens about the important issues facing the Garden State, and by Employers Association of New Jersey. Promotional support provided by AM 970 The Answer, and by NorthJersey.com and Local IQ, part of the USA Today network.
New Jersey's early educators and childcare providers are more than twice as likely to live below the poverty line versus the general workforce. Reimagine Childcare, formed by a coalition in New Jersey, is dedicated to improving accessibility, affordability, and quality of childcare and reimagining the way we support these essential providers. Learn more by visiting reimaginechildcare.org.